Welcome to the Health Revolution, the program that shows you how to have a life of vibrant well-being. In a world full of noisy health trends, we bring you clarity. We reveal the science-backed strategies that truly work in a sea of fads. We explore the physical strength, emotional resilience, and mental mastery. These are the keys to an enriched life. Join us for inspiring interviews with champions who've conquered life's health challenges. Are you ready to unlock your potential to live with vitality and purpose? Then join the Health Revolution. I'm your host, Adriana Morrison, health and fitness expert, speaker, and a mom who understands. Let's embark on this transformative quest. Together, we're about to change the game starting now. The information provided in this show is intended for educational and entertainment purposes only. Viewers should use their own discretion and consult with a healthcare professional for personalized guidance and recommendations. Welcome, everybody. You are watching the Health Revolution, and we are excited that you are joining us today. I'm your host, Adriana Morrison, and no matter which way you're tuning into us, please do not forget to hit the subscribe button because we want to stay connected to you. Also, at the bottom of your screen, there is a tab for show episode notes. Be mindful of that. We've got some important reference information regarding today's episode. And as many are aware, October is Breast Cancer Awareness Month. 1 in 8 women will be diagnosed with breast cancer globally, worldwide. And so this is a phenomenon we still need to have conversations about and be aware of the innovative approaches to having the right breast health and approach. Our guest today is someone that we have gotten connected with last year, and we're excited to have more conversations that are impactful with this topic. For once, we're going to dive deeper into some of the innovative approaches that are not often talked about, especially when it comes to breast cancer awareness and then being innovative. Take a look at this. Let's get to know him. Watch this. Meet Dr. Jawad Mustafa, an OBGYN ultrasound consultant and breast health coach with over 19 years of clinical experience. Dr. Mustafa is one of the few experts offering both medical and holistic approaches to help women reduce their risk factors for breast cancer. As the founder of Bebreastaware and breast health coach for Global Care Consult, Dr. Mustafa is dedicated to empowering women worldwide with essential knowledge and resources for informed health decisions. Today, we will learn how Dr. Mustafa integrates these approaches to support women's breast health and overall wellness. Dr. Jawad Mustafa, welcome back to the show. How are you?
Thank you for the introduction. I'm fine. How about you?
I'm doing fantastic. I know we got a chance to connect last year and you shared insights, and I'm excited about today's conversation because it still needs to be one that we must have no matter where we are. And I'm curious with you, the level of self-care that's out there and the concerns about the 1 in 8 women being diagnosed with breast cancer. What are some findings that you've noticed as we are moving through in societal times? What are some things that you're noticing about the trends?
Well, first of all, I would like to share a very brief stat and information regarding breast health trends, which are more common in younger females in this decade. For last couple of years, the statistics towards breast cancer in younger females is a very alarming trend because before that, in the literature and everywhere, it is mostly advised and advertised that breast cancer is a disease of women above the age of 40 years, in 40s and 50s and later on. It is a true fact that breast cancer risk increases with age, but we cannot restrict it towards the 40s and 50s and later on. In recent times, in recent years, the recent studies they indicate that the breast cancer risk factors and also the cases that are reporting and the deaths, they all are increasing in the late teens, 20s, and 30s, because this is the time where in recent times risk factors are piling up. especially due to sedentary lifestyles, our lifestyle choices, dietary habits, and after post pandemic, all things, the health scenario, personal and emotional health issues, all these contribute towards factors that are increasing, especially in younger age group, due to excessive stress, due to excessive uh, anxieties, due to different health issues, different career and responsibilities. So globally, we are having a trend where increasing risk and increasing cases of breast cancer in the younger females. And it is a very alarming trend because breast cancer in younger age groups is very aggressive mostly. It is hard to diagnose in early stage because there is no screening mechanism for younger females. In every healthcare system in the States, in Canada, in Europe, mostly it is advised to have a mammogram after the age of 40 years. But there is no
And you bring up something that we don't normally talk about, and I'm glad you're bringing this up. That younger and younger, more women who are younger are getting diagnosed with breast cancer. How come it's so hard to have a conversation overall? Why have we not been able to talk about this much before?
It is simply because all the guidelines, the medical guidelines in the text, medical literature, and research, it in the past decade or so, it was all focused on those cases that were diagnosed. But this is time now that we should focus on those which are not yet diagnosed but having excessive risk. Because in the 20s and 30s, due to dense breast tissue, and also nobody tells these girls and women that they are in the risk age group, so they are not so much worried about it. They don't do proper and detailed self breast examination on a regular basis. They don't visit the clinics or the doctor for breast examination, clinical breast examination. So as we are not guiding them, as we are not telling that they are in the higher risk group at this age and this era and this decade, so they are not worried about it. They don't seem concerned unless they find something, unless they have a lump, unless they have any concerning signs or symptoms. They don't visit a doctor. So if they are diagnosed late, if they are having a lump which is growing inside without any obvious sign and symptoms, when it is diagnosed, it's always stage 3. So late diagnosis, late treatment leads towards adverse effects and also complications. So it is a whole setup around us due to lack of awareness, lack of guidance, lack of guidelines, lack of screening, and also the most importantly, whenever even in this October month of breast cancer awareness, all the campaigns center around those who should be diagnosed or they are diagnosed. It doesn't center towards the healthy females. We don't talk about healthy females who don't have any kind of sign symptoms to guide them that they can be in the risk group. They have to be vigilant, they have to be proactive, they have to adopt those changes, those lifestyle and self-care modifications that reduce their risk of cancer in the 40s and 50s. So why not start it right now in your 20s? So this
Are there silent symptoms of breast cancer that are increasing for women who are younger than 40s and 50s? Are there any type of silent symptoms that we just don't know of in general?
Yeah, definitely. Because most of these cases, the breast cancer lumps, they are linked with estrogen hormone. Estrogen hormone is normally present in females. It is linked with their overall body growth, body shape, breast development, their menstrual cycle, their skin changes, hair texture, their mood swings, their emotional health. These are all controlled by hormones and dominantly by estrogen levels. So, in any girl or any female, if this there is a continuous estrogen dominance, either due to increased production or due to any other hormonal issues that contribute towards estrogen dominance, so it is silently increasing the risk of breast cancer as it triggers those changes, those cellular changes, those DNA modifications, which trigger cancer cell formation. So, the unrestricted, uncontrolled, and continuous increased levels of estrogen in the body, they don't pose any kind of obvious threat, because any person who is having estrogen dominance, they will feel like sometimes they are irritable, they will have more mood swings, they will have more digestive issues, they can feel breast pain, breast tenderness more often, they will
So,
have more
so I am
menstrual cramps.
So I am curious about two things. Number one, I know that we're having these days, it seems like we're talking more and more about hormonal imbalances. So my first question is there, is this something that you are finding that there's a correlation? Is there a connection between the estrogen dominance and the discovery of younger females, younger women who are presenting with that they are in fact ending up presenting with breast cancer? That's my first question.
Well, simply put it this way, that breast cancer is linked with estrogen. Most of these cancers, like 70 80% of lumps, they are linked with estrogen like hormones. So, in any female who is having continuous persistent issues that I have mentioned earlier, if there are sign symptoms which are linking towards these changes and they are constantly increasing, she is having all these issues which are increasing in their intensity, in the severity, duration is increasing. So she should be aware that there are some kind of changes that are going on which can affect her breast health also. It may not be evident at this moment, but it is adding up like numbers. So as many numbers we have, it increases the risk in the future.
So my next question is, if there is a history, say a woman is diagnosed with breast cancer, or there is a history that is presented in a family tree, is there a correlation with younger women in that family tree likely to be diagnosed with breast cancer? Is there any link between breast cancer presence and women who are becoming younger and younger in that particular family tree getting the diagnosis?
Definitely. Roughly about any person who has a family member diagnosed with breast cancer, mother, sister, or daughter, or any first relative. So automatically their chances of increase getting breast cancer increase by about 10%. So it is a one component to it. Secondly, due to different risk factors that are already present in the family, with or without genetic component, with or without genetic mutations or family history, we are experiencing these changes in younger girls and women because of different personal health issues, emotional health issues, hormonal imbalance, also due to dietary issues. Because our diet, it is a main contributing factor. It is loaded with pesticides. They are genetically modified strains. So they all contribute towards those risk factors, those elements that pile up one by one to our daily routine, and they increase the risk of genetic mutations, DNA mutations in our cells. So, having a family member with cancer does add numbers.
I'm glad that you mentioned that there is a tie, a connection to pesticides or pollutants that are just in society, and the risk factors being higher, and then also the food intake, how a person's overall diet, what their food habits are. And what have you noticed that those two have been skyrocketing, or that there's been a steady increase with that? Because I know that in general society has a hard time eating as healthy as we need to be. What are your thoughts on that?
Well, in our all the consumer products we get, they are all mostly processed. They are loaded with all kind of chemicals to increase their shelf life, to increase their presentation. They are treated with all kind of substance, chemicals, agents. So, as many we add these chemicals to our diet, our food, our crops like wheat, rice, all these crops, they are sprayed with pesticides. They are sprayed with all kind of different chemicals to increase their resistance toward diseases, toward viral infections also in the crops. So anything that we add to our diet which has all these chemicals inside, which are not regularized, because in most countries these pesticides, they are not of that quality and standard, and all they are not tested. Mostly in the underdeveloped countries we get all kind of low cost items which are sprayed, which are used, those dyes and all those chemicals to treat our food. So they do have carcinogenic activity. They do remain absorbed in those food items that we consume on a regular basis. Either we get them directly or we get them packed or shelved, but they do have all those carcinogens. So it is contributing towards factors, and it is a very alarming sign that more and more items we tend to consume which are packed, which are treated, which are having all kind of chemicals to increase their shelf life. So in our daily routine we are stuffing ourselves with all these chemicals.
What has been the input that you've gotten from patients when you bring this up? What are some things that what are some types of responses that you're hearing from patients when you start to have this conversation? The importance of what we're putting in our stomachs, how we're eating, the exposures to different elements. Are they surprised? Are they shocked? Is it unusual for them to hear from someone of your role that you're bringing this up? Because oftentimes we don't hear this type of language when we're talking to doctors, anyone in the medical space.
Actually, most people, when they change their diet, certain dietary items, when we ask them to modify these, to add certain food items and reduce certain, they do get a lot of benefit. Like a simple thing is reducing sugars, not the carbs, reducing sugars, the processed sugar, the commercially available sugar. If we reduce its quantity and if we minimize it, it does add to the health benefits, because it is simply adding to the fats of our body. It puts extra strain on the pancreas, extra strain on our body. So reducing sugars, reducing the salt, the added salt or the salt present in the preserved food items, reducing it, this has a lot of benefit to all the patients. Also, adding as much as fruits and vegetables to the diet, it helps in maintaining an alkaline nature, alkaline pH of the body, and it helps in body healing. It helps in maintaining a normal balance. So as much we increase the acidic foods, sugars, all the processed food, all the those deep fried food items, those preserved items which have all kind of stabilizers and acids added to them to increase their shelf life, to give them flavor, carbonated drinks. So all these items, when we reduce these and replace them with natural food items like fruits, like vegetables, normal fish, meat, so these items, they help in overall body immunity improvement, and they feel better
And I'm
just by
glad
simply changing the diet.
And I'm glad you're saying this because we need to hear this over and over again about the impact that sugar has had on the body. I know that we've got a lot that we're going to talk about. We're going to talk about self-care, especially for younger women and all that that implies, what we can do. First, we're going to take a commercial break. Stay right there. Don't go anywhere. We will be right back after this.
So NAD is something that we use for people who are going through withdrawal symptoms, whether it's opioids whether it's alcohol. GABA receptors in our brain is something that alcohol affects when we drink. So when you're going through alcohol withdrawals and I give you the calm bag or give you calm with GABA in it, it kind of gives your brain that kind of fix, so to speak, of the alcohol to help with the withdrawal symptoms. I'm not saying it gets rid of them. I'm not saying I give you GABA and you're good to go forever. That's not what I'm saying. It's again, just like everything we offer, it's a relief.
Introducing Launchpad, the perfect partner to help you launch your dream project to the world. We know that time is of the essence, and we're here to help you make the most of it. With Launchpad, you'll get access to the most advanced digital tools and strategies to take your idea from a mere concept to a fully fledged success. Whether you're an aspiring entrepreneur or a seasoned pro, we have everything you need to make your mark in the world. Launchpad, your ultimate launch partner.
Welcome back to the Health Revolution. We are talking about self-care and preventative breast health approaches to make sure that as the awareness of breast cancer continues to be a part of our society, that we are doing everything we can and teaching as many as possible about preventative care. And so our guest today, Dr. Jawad Mustafa, and we're going into details about some findings that women need to be aware of how preventative approaches are effective as we don't have to wait till we are older. And so before the break, Dr. Jawad, we were talking about, you started to highlight the correlation between certain products, sugars out there, and elements in life that do tie in the concern, the increasing probability of breast cancer diagnosis. And then we are now talking about self-care. And talk to us a little bit about some practical approaches that women who are younger can begin to implement so that there is a better footing on this topic.
Well, the first and the foremost is to learn breast self-examination on a regular basis, because this is one thing that can prevent a lot of issues. It is not just about finding breast cancer lump. There are many other findings, many other changes that are happening in female body, particularly breasts and nipples, right after puberty. So in their teens and 20s, early 20s, these changes are almost finished. This is a time of growth, the shaping and the skin changes and everything. So in this time, they should be aware that which changes are within the normal range and which changes they should be alarmed about, and they should consult with any healthcare professional. So if a female learns detailed breast self-examination about which items to be checked on a regular basis, the visual examination can be done on a daily basis or on alternate day. The detailed breast self-examination through palpation, it should be done monthly. So following this routine, this helps any girl, any female to learn any kind of changes happening in her body, and she can consult any healthcare professional which is relevant to her condition. So they can examine and guide them about different approaches and how to care about it before it gets to any kind of complication. So the second thing is to learn which diet items, which food items are required for her health, depending on her routine, her daily work routine or exercise routine or professional requirements. Because everybody is different, everybody has different metabolism. So one diet fits everyone is not applicable. So just to ask her healthcare professional, she can have a discussion about which food items are healthy for her, which can fulfill her calorie requirements as well as protein and fats requirement. Because we cannot quit any food, basic food item nutrient from our diet. We cannot skip fats totally, we cannot skip carbs, we cannot skip proteins. So we should have a balance. Thirdly, she should learn which kind of skincare products are good for her. Any skincare product which is loaded with fragrances, which has lots of chemicals, sulfates, parabens. So all these items, they disrupt the normal hormonal balance, and they have a tendency to be carcinogenic towards skin and also for breast cancer. Also, there are many commercially available creams for removing blemishes to increase fairness and everything. They all have those chemicals, they all have those heavy metals in them, they have steroid based components which have a very harmful effect on their hormonal balance. So, avoid these. Fourthly, they should be concerned and they should always consider having a proper fitted bra, as it damages the skin, the internal structures of the breast and nipples. Any bra that is ill fitting, that has a very compression effect, any bra that restricts the normal circulation drainage of the breast tissue, it is harmful. And also, the most important thing that any female in any age group is to have a balanced sleep and rest routine, because whenever we are sleeping we are healing, and if that time is not proper, if the sleep hours are disturbed, if the a person is having the routine in which she is awake in the late night hours, then the cortisol levels, the normal hormonal balance of estrogen, progesterone, they all will be disturbed, the thyroid hormone will be disturbed. So it all contributes towards having an ill health, lack of energy, and it contributes towards reducing their normal body immunity. So they all contribute towards increasing risk of cancers, different cancers, not just breast cancer.
You know,
So
you
these
bring
are
you,
some
you
steps.
you bring up a good point, and there's several points I do want to unpack here that you mentioned, and so I'm glad you touched on all of these. The one that strikes home for me is, say, the concept of sleep, and so it seems like there's more and more literature and research that ties lack of sleep to a variety of different health issues that we're not used to recognizing impacting our life on a greater scale than we realize. To your point, I remember coming across information about if chronic cortisol levels stay high, and it doesn't matter how old we are, it can wreak havoc on the body. And you've come across that before, yes?
Yes, definitely, because whenever our body needs time to rest, time to relax, to heal itself, because whenever we are in any kind of crisis, cortisol level increase, adrenaline level increase. But if that surge continues for days and weeks, then definitely it will suppress other hormones which are promoting health, which are promoting growth, cellular repair. So if this process continues over weeks and months, any person who is having any kind of emotional health issues, any ongoing stress, either due to any disease, any financial issues, or any concerns which keeps them awake in the late night hours, which reduces their ability to heal themselves, it has different kind of impacts on the body cells, and it reduces the body's own ability to fight disease. And one thing that helps in all this process is normal a good exposure to sunlight, a good exposure to outdoor environment, and also exercise. It increases our own body's ability to heal itself. Self
And I think that's a huge component. Of course, I'm going to cheer that one on in terms of physical activity. You know, we just don't have the greatest patterns and habits of moving and taking care of the bodies. Where have you seen trends that are in terms of sitting versus movement that that are concerning to you? Do you oftentimes see patients who maybe just don't really move around a whole lot, or that sometimes they make mention that they just haven't had a chance to exercise in the way that they think they should? The amount of the impact that physical activity has, can you speak about that?
Well, definitely, especially in the younger females in their teens and 20s, when they have a very busy schedule during their study hours, or when they are in their work environment in the corporate sector. So all these, they are linked with having a job routine or work routine, sitting on a desk, sitting on the chair for long hours, and in that time they are not doing any kind of activity. Particularly, their neck is always bent down to work. Their back is humped, so it reduces the body's own muscles tone, muscle strength, and it also reduces the body's own normal circulation of lymphatics. So it all contributes towards reducing the muscle tone, muscle strength. It increases the risk of getting spinal issues, and it also contributes towards ill breast health also. So all these factors, they are interconnected. We should not be just thinking that if we are doing one thing, it affects only one part of the body. Every body system is interconnected. So whenever we are in a sedentary lifestyle for a prolonged period of time, it reduces our muscle strength, muscle tone, and it contributes towards early aging. So all these factors should be considered by every female, particularly younger females who think they have the energy and capability to do more work, to sit more hours, to have more productivity on their digital scale, but it also affects their overall body strength, body muscles, hormones, sleep, mental relaxation. So they are all disturbed. So there should be a balance. We should teach them about simple exercises they can do while sitting in a chair, while lying in their bed. There are multiple exercises for different muscles they can do. Self massages, particularly breast massages on a regular basis, it has a lot of beneficial effect to promote overall breast health, to avoid different skin issues, and also to reduce the chances of getting different breast glands and duct issues. So
You know, and you bring up a good point in that when it comes to physical activity, we just as a society we're not moving as much as say in decades past. So that's an alarming trend. But then also you started to touch on some practical solutions. I'm curious about the holistic approaches to the self care. What are some things? What would be a first? So for anyone who is watching and thinks, wow, this is so overwhelming. I have to do all these things and I don't know where to start. Where would you want for them to start?
well, the first thing is they should realize that in their particular age group, what are the requirements for the daily food items, different calories they should consume, and what components they require. Because in the growing age, the requirement for calcium is more, vitamin D. They should consume a good amount of protein. So all these components, depending on their age group, they should learn, they should ask. They can search on the internet, but the best thing is to ask a healthcare professional who can design some kind of diet or nutrition chart for them. Secondly is to have a balanced physical activity, not to have a certain exercise routine. It is not required in most cases. Simple walking, jogging, or simple home-based exercises. There are many exercises that I teach my patients which they can do while sitting in their chair, while simply standing or lying in their bed. Because everybody, they have a different body structure. Most of them, they can jump around to have all those strenuous exercises. So there are simple exercises also that can help them. In the same way, there a regular breast massage routine. It helps in relaxation of the muscles, relaxation of the skin, and also it has a calming effect in most cases if it is done properly in a proper manner. Also, hydration plays a very crucial role. Whenever our body is dehydrated, it tends to age early. So, normal balanced hydration, balanced nutrition, having a simple knowledge of which food items are good for them. So, all these steps are actionable that they can adopt on a regular basis, one thing at a time, and it is not very difficult. It doesn't involve any kind of monetary compensation, any kind of uh, heavy investment. This all can be done in a setting, and that's why I teach them simple steps, actionable steps they can do and start on their own, just learning one time, and they can adopt these changes. And then on a regular basis, they can have a follow up about how to improve and increase the duration so that they can benefit from right from a sedentary lifestyle towards a normal healthy lifestyle, and then later to have improved fitness and improve the overall look and shape and all those aspects. So they can learn gradually, but the simple thing is to learn which food items, which lifestyle changes, which modifications can help them in their own setting without having to spend anything.
So, what has it been like to talk with other colleagues about some of these approaches and addressing breast health solutions and the concern that more and more women being younger need to know and need to be aware so that they can be proactive? What has it been like to talk to other colleagues in the medical space about this?
Well, I'm regularly in touch with different colleagues which are related to different fields. Like I have interaction with different clinical psychologists. I have interaction with different skincare specialists, plastic surgeons, different holistic healers. So I do come across with different individuals who share their insights about different things. And one of our program for Global Care Concert regarding breast health care, it involves the input from all these individuals. That any person who joins our this coaching program, they can seek guidance from a emotional uh, health counselor, from a clinical psychologist. We can add a dietitian to our coaching session who can provide insights about different health and food items they can add to their diet or reduce. We do have consultation from skincare specialists, from aestheticians, from plastic surgeons, because we do an integrated approach of medical and holistic aspects. So we provide them with all the necessary tools, the necessary information and guidance in which they can improve their own health and also their overall presentation, their look. Because many females who contact us about self-care and improvement, they are either in the social media, they are influencers, celebrities of different countries. So we come across different personalities, different persons with different requirements regarding their own health, self-care, breast care. So whoever needs any kind of personalized coaching, one-on-one coaching, we do offer all kind of services and aspects related to self-care, different medical approaches, holistic approach, depending whichever is applicable to their own requirement. So there are multiple things any person can adopt on their own by simply learning one or in one or two sessions, and then they can adopt these changes without any you can say hard effort. Simple steps, actionable steps, and it is very easy for every female.
So with all that you're saying is that these conversations are being had. Obviously, you have a protocol approach to being available for those who are seeking care and services. And it sounds like that there is that community of other medical professionals, clinicians who are also interested in getting the word out and just explaining the gravity of why we should pay attention in this manner and why younger women need to start becoming aware. And we're going to dive more into this. First, we're going to take a commercial break. Stay right there. Don't go anywhere. We will be right back after this. Thank you so much for watching The Health Revolution. Our show is growing, and it's all thanks to viewers like you. No matter how you found us, please hit the subscribe button so we can stay connected and continue to deliver amazing content to you.
Hi, I'm Adriana, and welcome back to Fit Bites. Today we're focusing on hip mobility, something important for both men and women, especially as we age. Now, keeping your hips flexible and strong is key to preventing pain and injury. Now, if you start to feel hip pain, it's important to take action early. Pain can stem from tightness, muscle imbalances, or even overuse. Now, simple hip opening exercises like lunges, hip flexor stretches, and figure 4 stretches can make a big difference. Adding these into your daily routine can improve your mobility and reduce discomfort. Now, if the pain persists, pay attention. Sharp or persistent pain could be a sign of something more serious, like arthritis or hip impingement. Now, if that's the case, it's important to consult a doctor or physical therapist to avoid worsening the issue. Low impact exercises like swimming or cycling can help keep your hips active without putting too much stress on them. Stay aware of your body and keep those hips moving. Now, remember, mobility is crucial for long-term health. So keep your hips open, stay active, and don't ignore any pain that lingers. Stay tuned for more Fit Bites with Adriana.
Welcome back to the Health Revolution. Our guest today is Dr. Jawad Mustafa. We are talking about innovative breast health solutions and implementing self-care at a younger and younger age to get in front of the diagnosis of breast cancer and having those ratios and the probabilities be in our favor. And Dr. Jawad, I wanted to ask you, how can women better advocate for their health, especially breast health, in a setting which they're not having they're having difficulty getting their point across to, say, the clinician that they're working with?
Well, the best thing is they should know which questions to ask to their healthcare professional whenever they visit them. The basic things are about which self-care routine is required for them, which skincare products are healthy for them, which food items they should adopt, and also supplementation can help. But the best thing is to have the diet which is balanced. Also, in case they are not having that kind of facility to visit their doctor, so the self-care tips different that we coach and we guide, they include self breast examination, self breast care, including skin care, about which like a simple tip is, if they are having a dry skin or any irritable skin, particularly in the breast or nipple area, then they should change the kind of body wash they are using, because it is drying up their skin and it is contributing towards skin damage. They can replace it with any skincare product, any body wash that doesn't dry the skin up. It, because the normal skin should have a protective oil like layer on the skin to avoid the cracking, the damage. So these simple tips, right from the skin till the inner tissues, their diet, their hormones, their self care routine, their sleep pattern, their emotional health, any ongoing stress and issues, we address all these aspects depending on their history, their clinical examination. So most of these patients and clients, they are online. They approach us through online different medium and source, and we provide them with all these solutions depending on their requirements. So in the recent times, in the last couple of years, more and more younger females, they are having breast health issues because of all the chemicals they use in the form of different hair dyes, their different skin care products, different cosmetics, and due to the excessive stress on their mind to have a better presentation, visual presentation through different online medium. So all these factors, they contribute towards added stress which was not present a decade ago. So this added stress, this added thinking of improving themselves to be more presentable and to add more impact to their social media presence, this constant stress adds to those factors which contribute towards ill health, and also they are contributing towards breast health issues also. Because in most cases, these influencers, these social media celebrities, and even celebrities of different countries, they tend to have a routine in which for 8 to 10 hours or 12 hours they have to be more presentable for the media. So in that time, they are having a posture which may not be comfortable for them, which may have a damaging effect for their spine. All the garments they wear, the dress, the bra they use, this all contributes towards skincare issues, towards breast health issues. It damages the inner ligaments of the breast. It compresses and damages the normal glands and ducts of the breast, and it causes premature changes in the breast skin, in the breast tissue and structure, making it prone towards sagging, making it prone towards different allergies, different carcinogens. They tend to get more absorbed in the skin as more and more skincare products are applied. So all these factors, they contribute towards those trends which are now we are experiencing, and they will get worse in the next decade. But they were not present a decade earlier, because this social media boom, this post-pandemic era, it has contributed a lot towards worsening of the health conditions, particularly due to the lack of awareness. We
You know,
have
and
provided the
you bring up a very good point that stress has far-reaching consequences if not managed, and the fact that here we are in several years after the onset of COVID and how worldwide impacting it's been. I have to agree with you. It seems as though our stress management levels are just not where they need to be, and that it plays a bigger role. And so, and you're seeing that, and you're having discussions with your patients, yes, about this.
Yes, definitely. Because regularly we are having different kind of patients, different people who ask questions, not just from my country, but from different countries, from Europe, from America. So all these patients, all these person, not particularly patients, any person who asks any kind of query through different social media handles. So the main concern they always show is that despite their best effort, they are losing their own health. Despite all the cosmetics, all kind of supplements they are using, all kind of coaching they are getting to have improving their overall fitness and everything, but due to added stress, due to improper diet, improper sleep, and lack of awareness about basic health concepts, we bombard them with the information that they should do this and that, but unless we provide them with the actionable steps through proper coaching, through accountability, because we provide coaching with accountability, that we follow them, we provide them with information, and we keep a track of their progress. So this helps in improving their health, this helps in reducing their stress levels. We regularly guide them about different techniques, how they can improve their health issues, and those issues which they are not encountering at this moment, but we suspect that they may have them a couple of years later because of their routine.
And
So we guide them right from the start.
And what I love about the level of proactivity that you're highlighting is that this is not the type of conversation that we're used to having. You know, it seems as though when this comes up for women, or just anyone who is facing a diagnosis of breast cancer, it's almost you don't hear much of the preventative language and the tactics that can help get ahead of this. And so I'm appreciative hearing that level of proactivity that you bring to the table, because we're used to hearing the other, in which someone is receiving a diagnosis and then they're having to weigh out the options of how do you address it, how do you eradicate the breast cancer in the body. I think this is fantastic. We're going to take a quick commercial break. We'll be right back. Stay right there. Don't go anywhere. We will be right back after this. Welcome back to the Health Revolution. We've been spending time with our guest today, Dr. Jawad Mustafa. He is a breast health coach. We're talking about innovative breast health solutions and the importance of that early preventative proactive approach so that we can get ahead of any breast cancer diagnosis at any point in time. Dr. Jawad, where can we find you in the virtual space?
Well, I'm pretty much active on Facebook. Anybody can find me through my Facebook profile, Dr. Jawad Official. And also, they can contact me through my LinkedIn profile. There I'm quite active and providing different kind of information regarding ongoing trends, researches. Dr. Jawad Mustafa, they can find me there by this name. So with these, I have my active websites where I have complete information regarding breast health, breast care, self-awareness, and everything that is relevant towards its diagnosis, treatment, guidelines. So on bebreastaware.org, this is my organization website where anybody can have access to all the information related to breast health. There is a booklet available. Anybody can download it. It has all the necessary information for self-care, self-diagnosis, and also through my Global Care Consult, they can contact me. My personal website. It will have different kind of self-care training programs that I'll be launching very soon. Global Care Consult is my organization. It's a women health coaching platform where we provide all kind of services related to breast health, emotional health issues, and also we provide second opinion regarding their ultrasound findings, ultrasound reports, so that we can help them in making informed diagnosis and help them in getting the proper treatment that they can get through a second opinion. It can help them in making those decisions which they might be having confusion about. So we are providing different kind of services.
And that's fantastic because that is a level of proactivity we need to be able to do more and more of. And Dr. Jawad Mustafa, I'm certainly appreciative of your time and your energy and you sharing your insight and some valuable tips and points that we need to keep in mind. Thank you so much for being here today.
Most welcome. Pleasure is mine.
And for all of our viewers, of course, you can find us on our website. Our website is thehealthrevolutiontv.com. There you can subscribe to our newsletter. You can also email us with any show episode ideas. On the upper corner of your screen, you will find our QR code, and you can certainly grab that as the crow flies. And then, of course, every single week, Tuesdays and Thursdays, you can find us on E360 TV on the Achieve TV channel, 1 p.m. Eastern, 10 a.m. Pacific. That is all the time that we have. Until next time, take care of yourselves. We'll see you soon.